Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Governor of Ekiti State, Dr. Kaide Fayemi, tests positive to COVID-19 as his counterpart in Abia State, Dr. Okezie Ikpeazu, tests negative. And United States records close to 4 million coronavirus cases and just under 142,000 deaths. Now, according to the Nigeria Center for Disease Control (NCDC), 576 new confirmed cases and 4 deaths were recorded in Nigeria in the last 24 hours, putting the total confirmed cases at 37,801. 15,677 cases have been discharged and 805 deaths have been recorded in 36 states and the Federal Capital Territory. Of the 576 new cases, they're reported from 21 states and the FCT, with Lagos recording 88, Kwara 87, the FCT 82, Plateau 62, Ondo 39, Enugu 28, Oyo 26, Taraba 24, Kaduna 20, Ebonyi 20, Edo 17, Cross River 16, Kano 14, Rivers 11, Ogun 10, Delta 9, Nasarawa 8, Osun 8 cases, Katsina 3, Imo 2, Kebbi and Borno 1 each. Now, the top 5 states in the country with patients on admission are Lagos with 11,456. The FCT has 2,229 cases still on admission. We have Oyo, and it has 1,079 cases. At number 4 and number 5 is Ondo and Delta states with 799 and 764 cases respectively. In the meantime, Lagos has made the highest recoveries, discharging 1,993 patients, followed by Edo State that has discharged 1,300. Kano is at number 3, discharging 1,125. 1,120 persons have recovered in Oyo State, southwest Nigeria, and Rivers is at number 5, having discharged 1,039 cases of COVID-19. Now, the governor of Ekiti State, Dr. Kaide Fayemi, becomes the latest high-profile individual to test positive for the coronavirus. The governor who confirmed this, his status on his Twitter handle says that this was his 3rd time of taking the test. According to him, he's feeling well, isolating at home and receiving the best care from his medical team. The governor says he's delegating critical tasks to his deputy, but will continue his routine duty from home. Dr. Fayemi joins the list of governors who have tested for COVID-19. Some of the governors who battled the virus and recovered include Governor Bala Mohammed of Bauchi State, Sheyi Makinde of Oyo State, Nasir El-Rufai of Kaduna State, and others. We have Ifeanyi Okowa of Delta, of course, Oluwarotimi Akeredolu of Ondo State. It was, however, a different story for some of the others, like the former chief of staff to the president and the immediate past governor of Oyo State, who died as a result of complications from the virus. Now, one of those high-profile governors who have indeed made a recovery is the governor of Abia State, and he expressed his gratitude to God and to all Abians for their prayers after a period of isolation, treatment, and recovery from COVID-19. The governor also thanked the team of doctors and other medical personnel who attended to him for their dedication and professionalism. He also expressed his gratitude to the deputy governor and members of the State House of Assembly for their support during his period of absence. Now, over in Lagos State, of the latest 29 patients who have recovered from COVID-19, 7 are females and 22 males, including 5 foreign nationals. The governor of the state and incident commander, Babajide Sanwo-Olu, also gave a breakdown of the patients from the different isolation facilities. He says 6 of the patients recovered from Gbagada, 1 from Magidingbi, 7 from Etiosa, that's Landmark, 9 from Monikon, and 6 from mainland infectious disease hospital isolation centers, all discharged after full recovery. According to the governor, Lagosians should not be caught off guard and take responsibility against the coronavirus by wearing the face mask, observing physical distancing, and practicing hand hygiene. Now, Benue State government is delving into manufacturing of hand sanitizers and other non-pharmaceutical measures, indeed, to assist in the pandemic fight. According to Mr. Godwin Oyiwona, the Commissioner for Science and Technology, is now making alcohol-based sanitizers WHO-approved standard to effectively curtail the spread of the pandemic.
It is not just a sanitizer that people just go and produce anyhow. It's a standard World Health Organization approved sanitizer in line with the COVID-19 policies and principles. So we actually did this to make sure that we, the youth of this country, the youth of Benue State, will think out of the box to do something for their life and for the citizens and for entire Nigerians at large.
Joining us from our Abuja studios is Mr. Ali Ibrahim, Director, Pharmacovigilance Post-Market Surveillance with NAFDAC. Thank you so much for joining us on the program.
Thank you.
All right, let's start from Nigeria, and especially how NAFDAC is responding to the production of fake hand sanitizers across the country.
Thank you very much. NAFDAC, under the leadership of Professor Mojisola Christian Adeyeye, in an effort to ensure that there are no fake hand sanitizers in circulation in Nigeria, as far back as 16th of March 2020, directed that covert surveillance will be conducted in 36 states of the Federation plus FCT. During these surveillance activities that were conducted, it was established that there was some unregistered hand sanitizers in circulation. And these unregistered hand sanitizers have no name and full location address of the manufacturer. In addition, they have no NAFDAC registration number. It is therefore very easy to detect them. And as a result of this, there is extensive enforcement activities in the 36 states of the Federation and FCT. And during these enforcement activities, the fake and substandard hand sanitizers that contains below 60% of alcohol, which is required, were mopped up from circulation, and the distributors and retailers were subjected to enforcement activities to serve as deterrent. In addition, samples of these hand sanitizers that were not registered were taken to NAFDAC ISO 17025 accredited laboratory, and the result of analysis revealed that they contained less than the minimum 60% alcohol required. Having established this, the agency published an alert to inform the public that the substandard hand sanitizers are not supposed to be procured and used. In addition, the members of the public, especially the healthcare providers, were implored to contact NAFDAC with any information that they may have regarding the manufacture, distribution, sale, and use of unregistered hand sanitizers. And this has really helped us because most of the activities we do is as a result of accurate information we have from the members of the public. And in view of this, we have been able to remove the unregistered and poor quality hand sanitizers from circulation. And in an effort to ensure that there are quality hand sanitizers available for members of the public to use, the NAFDAC, under the leadership of Professor Mojisola Christiana Adeyeye, introduced an expedited registration pathway to accelerate the registration process of hand sanitizer that are manufactured by genuine pharmaceutical companies in Nigeria. And through this process, between 23rd March and end of April, the agency was able to register more than 100 hand sanitizers of various packages and various brands. And in this way, as I'm talking to you, there are quality hand sanitizer available for use by the members of the public.
All right, Mr. Ibrahim, I must come in now. You've been talking extensively at the surveillance capacity of NAFDAC, especially to hand sanitizers, but there's also the angle of face mask and perhaps the right face mask that we should be wearing. And we know that a lot of people are also producing face masks for sale. So is there also a check with regards to the type of face masks that are in circulation as well?
Actually, we have a report on some face masks, and immediately the Director General directed that immediate action should be taken. We conduct investigation on that, and all the ones that were involved were removed from circulation. So presently, as we are taking, we have less cases of fake masks in circulation, and the agency has heightened the surveillance on these activities to make sure that whatever is available for use conform to quality standard that will be able to protect the Nigerian people from the spread of COVID-19.
Mr. Ibrahim, on the issue of the race for vaccine, and looking at us here at home in Nigeria, where are we with, what is NAFDAC getting in terms of treatment regimen and vaccine production and research?
NAFDAC, as a regulator, is collaborating with WHO and other regulatory agencies around the world. And what is being done globally is being shared with NAFDAC, and our researchers and scientists are also looking at what is available. But as we are talking, no country or no regulatory has approved any vaccine for management of COVID-19. But we are in touch with scientific findings and updates. And what we are doing locally is to encourage our own people who are producing some herbs, which we ask them to submit it for evaluation to make sure that those that might be useful are listed, and if efficacy tests have been conducted and they have been proven to be very effective, then full registration will be granted for those products to be used in Nigeria. So at the moment, we are sharing information regarding the development of vaccines in some countries that have been identified for this purpose.
All right, we'd like to thank you, Mr. Ali Ibrahim, Director, Pharmacovigilance, Post-Market Surveillance with NAFDAC. Thank you for joining us on the program.
Thank you very much for providing a platform for NAFDAC to reach out to millions of Nigerians.
All right. Have a great day. Well, we've just since been joined by Dr. Olusumade Olatunde, Medical Director, Isola Hospital, Lagos. Thank you for joining us.
It's a pleasure.
We're going to take a break in a short while, but I wanted to get your thoughts on perhaps the hope that we can have a herbal or traditional sort of treatment regimen to curbing COVID-19.
Can I start by saying that the work, the research that is being done for development of vaccine is such that what we have at the foreground now is the vaccine that is being developed by workers in Oxford University. The name of that vaccine is ChAdOx1N COVID-19. And the first clinical trial that was carried out over 1,077 subjects. It resulted in development of significant antibodies in 100% of cases. About 90% of them developed enough antibodies within 28 days of giving the vaccine.
Well, we're going to come back to hear more about that when we return after this break. Please stay with us. Welcome back to the program. We've been talking to Dr. Olusumade Olatunde, a medical director with the Solar Hospital, Lagos. Thank you for your patience. So you were talking about the vaccine, and I was asking if we can have a sort of treatment herbal solution to COVID-19.
I immediately moved away from that. If we want to defeat COVID-19, we should be scientific, like the rest of the world. And I said that on the horizon, we have the most important vaccine now that has passed the stage 1 clinical trials. I told you that it is 100% efficacious. The second trial is going to involve about 30,000 people. The reason why it has to go outside Britain is that the incidence of COVID-19 is reducing. So 2,000 people in South Africa, 5,000 in Brazil, about 30,000 people in the US. In fact, I can tell you that the British government has paid for 100 samples, 400 vaccines upfront. That is what we should be talking about. Because what is behind it is another coronavirus that causes catarrh, cold in monkeys, was designed to look like our coronavirus.
And you say our, the world's?
The world's coronavirus. What they just do, you know, the coronavirus had that spike protein. They just put the spike protein on that coronavirus, make it look like coronavirus, give it as a vaccine, and it's beginning to work brilliantly. And countries have already started paying, even before it gets approved by FDA, because you have to have 100,000 people approval and things like that. That is the hope of the world. That is where we should be looking at.
All right. We also understand that the former Minister of Health, also director at the World Bank Group, Mr. Mohamed Pate, has since joined us via Skype from the United States. Thank you for joining us at this time. I'd like to begin by asking your perspective of how Africa is winning the war, in COVID-19. How ready do you think the continent is to dealing with the virus cases? Africa is now over 736,000 confirmed cases.
Yes, thank you for having me. I think over the last 6 months, we've learned quite a lot regarding this new virus, the novel coronavirus that has emerged initially from China and now has caused a pandemic all over the world. Before the pandemic, the African countries, in terms of their preparedness rating, the average was 2.1 out of 5. So to some extent, prior disease outbreaks had led to some improvement in parts of the continent, but we're seeing still challenges ahead. For instance, testing is still inadequate in many countries, and health systems, which have been weak before then, poorly financed, are being stressed. And the wider socio-economic impact of this pandemic, I think, could be significant. We're seeing the pandemic unfold initially, like I mentioned, in East Asia, from China to Europe, to North America, Latin America, South Asia, and gradually the rates are increasing in the continent of Africa. So national leaders have to really pay attention and really stem the tide. Otherwise, health systems which were weak can be overwhelmed with disastrous consequences for people's lives, but also for livelihoods.
Are you worried that there is this idea with the continent's perhaps youth being about 60%, and that even if the virus were to populate, that we would recover because of the age of our population?
This is a new virus. I think over the last 6 months, like I mentioned, we've learned a lot. Initially, the perception was that it was mostly in elderly populations. But what we're seeing is that really even the younger ages are not exempted. This is a virus that the human population has not experienced prior to this last 6 months. So I don't think we should be complacent. And seeing the rates of increase on the continent, I think we should not take it for granted. Every life that is lost that could be prevented is a tragedy. And so there should be no discomfort. Now, beyond the impact of the virus itself, we're already seeing the secondary crisis that the virus has unfolded: disruption in health services, disruption in immunization services, in maternal and child health services, in malaria and HIV treatment and TB treatment. Those are also significant. And so really, this is a very serious challenge for the whole world. It's a 1 in 100-year challenge that we have, and we've seen even the higher income countries struggle to deal with it. And those countries that have weaker health systems, that have issues with human resources, particularly the frontline health workers, they have to really pay attention to this and sit up and really have plans to be able to tackle it head on, including accelerating the testing of suspected cases, confirming them, isolating them, and also enforcing social distancing measures within their context so that people would apply the mask, but also be able to minimize the risk of transmission, because we now know how this virus is transmitted.
All right, Dr. Olatunde, finally to you. Apart from testing, which is a huge challenge, what other gap do you think we need to cross to curb the virus spread?
The gold standard is testing. If you look at the case of Rwanda, they have been able to ramp up their own tests. And I better tell you that the basic gold standard test is real-time PCR. And you can adapt what is called the gene expert that is used to test for tuberculosis.
But that's what they're doing.
You can actually
Isn't
adapt
that what
it.
the NCDC is doing?
But if Nigeria's population is more than 150 million, and we have not tested 1 million, you know, we should have gone beyond the idea of criteria for testing. We should have gone to a level at which everybody who wants to test can get tested, such that you can look at statistics and look at the incidence of people that are positive that are not showing signs. That gives you a gravity of the problem. The former minister mentioned something, and I want to throw a light on it. The age distribution of Nigerians, majority of Nigerians are less than 60. That is to say that they cannot catch coronavirus. But it is important to note that in younger age group, the outcome of coronavirus may not lead to loss of life. But a lot of people believe that there are a lot of long-term sequelae that years after having coronavirus, people suffer from. So people who are not going to die may suffer a lot of personality disorders.
We're still learning
so
more
many
about it.
problems, you know.
All right,
So,
we'd like to thank you. Wish we had more time. Hopefully, we'll bring you back again. Thank you so much, Dr. Olatunde. Thank you. And also the former Minister of Health, Mohamed Pate, Global Director of the World Bank Group. Thank you for joining us on the program.
Thank you.
The United States has now recorded close to 4 million coronavirus cases and just under 142,000 deaths. With these numbers, President Trump seems to have adopted a new tone as virus caseloads spike across the U.S. In his first media briefing on the coronavirus in months, he concedes that the virus would get worse in the country before it gets better, also asking all Americans to wear face coverings, saying they show patriotism. Our website, channelstv.com, has the latest news. All you need to do is log on and you can access news in health, politics, business, sports, Africa, and around the world. You can, of course, see all the figures, the coronavirus spread there on our website, channelstv.com. Thank you for watching. I'm Millicent Nwaka. Bye for now. Stay safe.